Stakeholders attending the National Conference on COVID-19 have called upon Kenyans not to lower their guards, saying the country is still ill-prepared in the event of a second wave of the COVID-19 disease. The experts say despite gains made in the last 6 months of response to the pandemic, the country's healthcare system remains fragile, and gains made so far could easily be lost if Kenyans continue to behave normally. Purity Museo with that report.
Stakeholders from the country's entire spectrum trooped to the KICC in Nairobi for the first of its kind national conference on COVID-19 pandemic to assess the country's response to the pandemic.
The imported things are still very expensive. And just getting them here. The fact that if we can produce them here, we'll be able to meet that demand.
However, Kenyans were reminded that the country had not yet won the war against the deadly COVID-19 disease, despite the recent reduction in infections.
The possibility of a second wave of this pandemic is real, as we have seen in other countries. As an affirmation that the enemy is still within our borders, we continue to record new infections every day, even as we speak. And in that regard, to forestall what is happening elsewhere, we must continue adhering to the protocols issued by the Ministry of Health.
Who has been at the forefront in breaching the rules in the fight against COVID? Is it us? Me being one of them? And if so, then what can we do so that we as the fault lines can be curbed so that Kenyan lives can be saved?
The president cautioned that the significant drop in infections from 13% in June to 4% in September was not a license for Kenyans to start behaving normally.
With these figures, we can all be tempted to celebrate, more so because we are now below the 5% positivity rate recommended by the World Health Organization for reopening. Yet these achievements are a paradox in themselves.
Health Cabinet Secretary Mutahi Kagwe urged Kenyans to embrace the new normal since the virus would be around for long.
We have built substantial capacity. We are talking about nearly 400 beds that we now have across the country, and I'm talking about ICU beds. From 0 isolation beds, we are talking over 7,000 isolation beds across the country. We are talking about health workers who have been out there, and community health workers who have been out there visiting people in their homes and so on.
The stakeholders further called for an economic recovery strategy.
There's too much concern about consumption, taking away from the national cake and expanding the national cake. This itself is actually a recipe for disaster.
Deliberations at the National COVID-19 Conference will guide the country into the new normal. The ball has now been thrown into the hands of Kenyans to strictly follow the containment measures to prevent a possibility of a second wave. Purity Museo, Channel 1 News at KICC, Nairobi.